opened the conference, and now I'm passing the floor to Magdalena from Helsinki Foundation of Human Rights to carry on with the first set of presentation. Thank you.
Thank you very much. Awesome. We're exactly on time, so precise. Good morning, everyone. My name is Magdalena Dąbrowska. I work on drug policy in Helsinki Foundation for Human Rights, based here in Warsaw, not in Finland. We are the Polish human rights and watchdog organization, actually one of the oldest in the country. What makes me really happy, actually, that the human rights, one of the main human rights institutions in Poland, a number of years ago, picked up drug policy and added it to its portfolio, clearly recognizing that this is the human rights issue, what we all, I believe in this room, know and believe in. Before I open the panel and give the floor to the distinguished speakers that we have today, let me also reiterate the words of gratitude to the police headquarters and to Inspector Waszkiewicz personally for hosting us here in this super busy time. You may not know that Inspector is preparing a big event very, very soon, which will be celebrating the 20th anniversary of the human rights protection system in the Polish police. Thanks to this system, we have a number of police officers who are trained in human rights, and as Inspector Waszkiewicz advising on the human rights issues. And I believe it's important to mention that because actually this is one of the examples about how to make the two ends meet, the policing angle and the human rights angle. And this is exactly what we will be focusing on today, how to meet the two ends and to make sure that we all work for the good of the public health, and I believe for that the human rights really need to be in the center. And because we are so international community here in the room, people coming from many different countries, we decided we will start the conference from the international perspective, the broad one, and then characterize the region as well. And during the day, we will narrow it down and focus more and more on concrete examples and then discuss the possible ways forward. So let me welcome my distinguished panelists. As I said, from the top, a human rights protection system, and this presentation will be given by Professor Michel Kazatchkine, very well known to the region, thanks to his 35 years of experience and work in the region, in the regional and global health as a physician, researcher, advocate, policymaker, diplomat. Let me just mention a few of them. Michel used to be the executive director of the Global Fund to fight AIDS, tuberculosis, and malaria, and for many years also the UN Secretary General Special Envoy on HIV/AIDS in Eastern Europe and Central Asia, as well as special advisor to the UNAIDS, which is the joint UN program on HIV/AIDS. Currently, he's a senior advisor to the Regional Office for Europe of the World Health Organization, and by many of you known as the member of the Global Commission on Drug Policy, and forget also the member of the Regional Commission on Drug Policy. So Michel, over to you. I have no idea how you can squeeze the 35 years of experience in 10 minutes, but, but I'll ask you to try to stick to the time limit. Thank you.
Dear Colonel Laskiewicz, honorable representatives of the Ministry of Justice, and dear participants, good morning. And thank you for this opportunity to address you on behalf of the Global Commission on Drug Policy, or 20 6 members of the commissions are on this slide. The commission was first chaired by former president of Brazil, Fernando Henrique Cardoso, then by Ruth Dreyfus, former president of Switzerland, and currently chaired by the Honourable Helen Clark, former Prime Minister of New Zealand and former administrator of UNDP. And we also have a regional commission for Eastern and Central and European and Central Asian region. It's a much smaller commission, and it is chaired by former President Aleksander Kwaśniewski from Poland. And I'll just use this opportunity introducing the commissions. I've been a member of both commissions since their inception. Both commissions advocate for drug policy reform that is based on that prioritize health and human rights. And let me just advertise for the forthcoming annual report of the Global Commission that this year will focus precisely on criminal justice and drug policy launched on December 5 in a few days. So, dear participants, let me remind you that the preamble of the 1961 Convention on Narcotic Drugs, which Magda mentioned, states that the welfare of mankind is the primary objective of that convention. Now, unfortunately, if we look back 60 years later, the current international drug control system in many countries, particularly in this region, have not led to the achievement of those objectives. It has, in fact, fostered a criminal justice approach to drugs that has failed to reduce drug use and production and has resulted in poorer health outcomes, violence, and human rights violations. So the focus of my few minutes here will be around decriminalization as a harm reduction intervention. And why is decriminalization a harm reduction intervention? It is because criminalizing minor drug offenses such as possession for personal use and use is a flawed policy. Why is it a flawed approach to drug policy? Well, first, because, and Colonel Laskiewicz mentioned it himself, criminalizing drug offenses has proven ineffective in deterring drug use. The global supply of opiates, cocaine, new synthetic drugs has continuously been increasing. Drugs are cheaper, more potent, more available, more broadly used. And there is evidence from you, the police, that jurisdictions with heavier level enforcement do not experience lower levels of drug use than those who do not address drugs in such a punitive manner. Second, criminalization of drug use and possession for personal use, along with stigma, discrimination, and violence, has been restricting the provision and access to harm reduction services. And there's experience on this from many countries across the world, including in this region. And as a result, you know well, today is World AIDS Day, that HIV and hepatitis C in people who inject drugs and their sexual partners continue to grow in Eastern Europe and Central Asia and continue to be a public health emergency that region has failed to address. Third, criminalization of drug use and possession has resulted in systemic violations of human rights. For example, because we're here also with an audience of judges, violations of due process in drug offense cases. Presumptive guilt, for example. Many legal systems across the region assume guilt for possession, undermining fair trial standards and shifting the burden of proof to the accused, or else coerced confessions or evidence obtained unlawfully. And here I'd like to say that the role of law enforcement is a key factor in perpetuating or not human rights violations. Law enforcement practices that focus on punitive measures, such as stop and search and the criminalization of low-level offenses, disproportionately target it. Fourth, criminalization of minor drug offenses has driven mass incarceration and prison overcrowding. And I was very interested listening to our colleague from the Ministry of Justice as you know, Eastern Europe and Central Asia have some of the highest rates globally, especially for drug-related offenses. And I must say Ukraine is the country having the highest incarceration rate in the region. I'm just reading Criminal Code Article 309 in Ukraine, paragraph 1. Personal possession-related illicit substances are punishable by a fine of 1,000 to 3,000 tax-free minimum incomes, or correctional labor for up to 2 years, or arrest for up to 6 months, or restraint of liberty for up to 5 years. And the conditions of the prisons around the region, are challenging. High prison population, overcrowding, inadequate healthcare infrastructure, chronic underfunding. And they have contributed to prisons in the region being focal points for the spread of HIV, hepatitis, and tuberculosis. And with some exceptions, and I was very interested in hearing from Poland this morning, I know about Moldova well, but except for some places, in most countries in this region, harm reduction services in prisons are either very limited, if not inexistent. And finally, the funds that are allocated for incarcerating people who use drugs massively outweigh the funds that are devoted to prevention and treatment. And while the cost of ineffective prohibition law enforcement is huge, the benefits of harm reduction and the cost effectiveness of harm reduction are undisputable and have been documented in the scientific literature. So judges should really consider here proportional sentencing. And they should consider and prioritize alternative measures to incarceration whenever appropriate. I also believe there should be no mandatory minimum sentencing, a big issue since we talk globally in the US at this time. And finally, it's also important not to overlook the impact on people of a criminal record. These are sometimes less visible consequences of criminalizing drug possession, but criminal records resulting from drug-related convictions can have many collateral consequences affecting the person's employment, education, housing, and family life for women, for example, that are separated from their children. Kofi Annan, a founding member of our commission, used to say, I believe that drugs are harmful, but I believe that a criminal record can be a greater threat to a young person than the occasional use of a drug. So, dear participants, there is now ample evidence that decriminalization of drug possession and use, when it's properly implementing, brings a lot of benefits. Decriminalization of drug possession and use can reduce stigma and discrimination. It cuts down on criminal justice costs and to public budgets, and it lowers barriers to access health and social services. And as you, I'm sure, well know, Portugal and the Czech Republic in this regard are very good examples in our European region. So the way forward is to adopt policies that prioritize individual and public health, decriminalize drug use and possession for personal use, increase access to harm reduction, redirect some of the funding that goes to punitive measures to health interventions, and refocus law enforcement on serious crime, trafficking, and money laundering. And here, a robust system of law enforcement is needed to actually combat corrupt practices that exist and ensure that police officers view their role as a broader public health effort. And finally, one more consideration that I would like to bring your attention to. At the end of the day, we know that please know that the conventions allow for decriminalization. There is no conflict between the conventions and a decision that can be taken by a member state of the UN to decriminalize drug use and possession for personal use. And we have experts from UNODC, I see, in the room to help you with understanding that complex system. So UN conventions allow for decriminalizations, but UN conventions and the international drug control system as it stands really restrict the capacity of member states to fully adapt their policies to align with scientific evidence, public health, and human rights. So I think the question we should ask now is whether there is a conflict between the conventions and human rights and international human rights law, whether the conventions and their translation in criminal justice approaches is actually conflict with universal human rights, including the right to access health and decent care, the right to freedom from discrimination, the right to equality before the law, and the right to privacy. So this is why, as a Commission, we strongly support the call that was made by Colombia at the last CND with over 60 member states. The CND is the Commission on Narcotics and Drugs, the governing body of the UN on drugs in Vienna, calling for an independent review of the international drug control system. It's time to have an independent review to ask the question, is that system still best fit or optimally fit for its purpose? And more generally, I think it's time for our discussions to raise the debate beyond decriminalization, beyond harm reduction, but questioning really the relevance of prohibition approaches and the relevance of the current international drug control system. Thank you.
Thank you very much. I realized I unintentionally lied a little bit because my watch stopped working. So we are not that much on time. excellent timekeeper, with other words. So I'll ask the panelists to keep their speeches within the framework of 10 minutes, understanding this is super difficult because the experience is so huge. So thank you, Michel. Thank you also for reminding us that today is December the 1st, the World AIDS Day. And this year's slogan proposed by the WHO sounds "Take the Rights Path." So right now, with the next presentation, we will hear even more arguments and justification why to go into the rights path. This presentation will be delivered by Elina Steinerte, a lawyer from Latvia, but actually more importantly today, the member of the UN Subcommittee on Prevention of Torture, so still the UN level of reflections, former member and chair rapporteur of the Working Group on Arbitrary Detention, commissioner at the Jersey Law Commission, and also academics, visiting professor at Jersey Law Institute and visiting fellow at the University of Bristol. So over to you. Thank you.
Thank you. Thank you very much. Good morning, ladies and gentlemen. It is really my pleasure to address this distinguished audience of true experts in policing, in judiciary, because you are at the front line when people are arrested, when they are remanded in custody, pending trial, as a result of implementation of drug policies and associated legislation, when these individuals are being sentenced, and of course when they are then either released on alternatives to detention in not so many countries, but nevertheless, as well as when they are actually in custody in prisons, serving their sentences, and of course post-sentence upon release. I stand to you in front of you today as UN expert in human rights, international human rights law. As I had the honor of serving the mandate of the United Nations Working Group on Arbitrary Detention for 6 years, as already mentioned, and I am a currently elected member of the UNSPT, Subcommittee on Prevention of Torture, which is the treaty body established in accordance with the optional protocol to the Convention Against Torture. And so in my professional work, I too am on the front line of the human rights of everyone who is deprived of their liberty. I intentionally say deprived of their liberty as opposed to detained, to connote this wider notion of when deprivation of liberty actually can occur and when it does occur, which is particularly important for the context of drug policies. And I'm adding my voice to this discussion today in this interjunction. Quite often the positions of policing and human rights world is being kind of juxtaposed as opposing each other, that they are somehow colliding and fighting against each other or coming from different worlds and different perspectives. And I would like to submit that that is not true, as I'm sure most of you, if not everyone in this room here with me today, will agree. But let us start with just some figures, which already has been noted by previous speakers, but which you, I'm sure, all are very well aware. We are talking about nearly 1 million estimated people who are deprived of their liberty worldwide because merely for drug use or possession for personal use. They are either in prisons or in these so-called rehabilitation centers and facilities. In addition, around 2.5 million people are incarcerated for drug offences globally within the criminal justice systems, which make drug laws a significant contributor to the global prison overcrowding, points that have already been alluded to the learned previous speakers. So I'm not, especially in the interests of time, not going to go over these elements, but what we do know is the significant impact on prison overcrowding because of the drug policies. We know the significant problems of the drug use in prisons within people who are deprived of their liberty. I do, however, want to mention two specific contexts for the deprivation of liberty, and these are the compulsory drug detention centers. As we know, in some countries, people who use drugs are mandated to undergo treatment in facilities which are run by public authorities. These are known as compulsory drug detention centers, or CDDCs, often as alternative to incarceration or as compulsory intervention following release from the prison. There are also private rehabilitation centers, and I use the word rehabilitation very loosely here because in most of these instances, 99% has very little to do with actual rehabilitation. These are intended quite often to hold people against their will in private drug facilities, often run by religious institutions or by for-profit organizations in several regions around the world. What we also know in relation that there are several issues concerning with regard to the risks of torture and ill treatment, in particular of people subjected to drug-related detention. The most widely reported forms of torture and ill treatment can take place in the form of denial of evidence-based treatment for drug dependency, particularly when connected to acute mental or physical pain due to the withdrawal symptoms. Physical and mental violence, abuse or degrading treatment against people who use drugs, which is disguised as kind of tough love treatment, discipline-based rehabilitation, if those words could even be put together. Detention in overcrowded and unsanitary facilities, already noted, the denial of appropriate food, clothing, and adequate standard of living in place of detention, be these prisons or so-called rehabilitation facilities. And finally, forced labor. So let us turn to some of the challenges that have been identified by the specific UN bodies, and I predominantly will come from the perspectives of the two mandates that I have had the honor and continue to have the honor of serving. So, Working Group on Arbitrary Detention, issues of deprivation of liberty, specifically absolute prohibition of arbitrary deprivation of liberty, and the United Nations Subcommittee on Prevention of Torture, so prevention of torture and ill treatment. And specifically focus on policing and the investigation stage to begin with. What we have seen in our practice, in our work, is the so-called special police operations, so-called drug raids or frisk practices, whereby in some countries we see random drug testing and stop and frisk practices used as ways to identify drug users or those with drugs in their possession, with the aim of arresting these individuals, which, of course, is a challenge from the point of view of policing. These practices are a marked departure from the requirement of probable cause for legal searches and considerably diminish the human right to security of the person, as well as has significant negative impacts on the absolute prohibition of arbitrary detention. Who is to be tested? Who is to be searched for possession of drugs? All of these decisions can be highly subjective, often based on persons' physical appearance, their gender, their age, their race, ethnicity, their status as a migrant worker or sex worker, or the actual geographical location where this person is, the facility, the vicinity around this person. A high number of arrests for drug-related offences may be used in some states as an indicator of successful law enforcement activities, especially in those countries which use the institute arrest quotas for the police as a kind of performance indicator. Upon arrest, such persons are held in police stations, which, as we know, rarely have provisions for medical assistance, especially for withdrawal symptoms. But of course, as frontline police, are somehow to deal with these very significant health issues, which, let us be honest, should be addressed by healthcare professionals rather than the police. What we also see is interrogation under influence and quite often in absence of lawyer. We all know that detainees are not to be interviewed or interrogated while they are or are suspected to be under influence of drugs or alcohol, and all detainees are to be given access to effective medical treatment while they are experiencing withdrawal symptoms in the early stages of their detention. To do otherwise, of course, casts doubt as to whether the detainees actually understand their rights, whether they are providing accurate statements to the police, particularly in absence of any family members or legal representation during such interviews and even interrogations and statements. There is, of course, also a possibility of coercion and even extraction of confessions, Because let us be honest, for someone with acute withdrawal symptoms, refusal of medical help without medical treatment means that it would meet the threshold of ill treatment, if not torture, in a particular case. Testing without consent or judicial warrant. Any testing which is including by obtaining a blood or urine sample be undertaken only with a warrant approved by a judicial officer should be the rule. And finally, the failure to promptly present the detainee before the judge is a particular challenge in those laws impose longer periods for which individuals arrested on suspicion of drug offences may be held before they are presented before judicial authority, which of course poses a problem with Article 9 of the International Covenant on Civil and Political Rights, and namely may lead us to arbitrary deprivation of liberty. On pretrial detention, we know that there are countries where we have automatic compulsory pretrial detention for drug-related offences, which poses a particular challenge from the perspective of judiciary and Article 14 of the International Covenant on Civil and Political Rights, the right to fair trial. An individualized judicial determination of whether pretrial detention is reasonable and necessary must be made in each individual case, on the case of each individual person arrested, and decided whether to remand this person in custody, regardless of the crime with which the person has been charged. An additional challenge in some of the countries is the lack of dedicated pretrial detention facilities, which means that the police are expected to look after pretrial detainees. Now, if we move on to the context of, to the next step in this criminal justice system and look at the trial and sentencing practices, denial of fair trial guarantees is a very broad range of issues that has been identified both by the Working Group on Arbitrary Detention as well as the Subcommittee on Prevention of Torture, because of course the legal safeguards are also essential safeguards to prevent torture. These include not being informed of the reasons for arrest and charges against those who have been arrested, and reliance on confessions which are made under circumstances which may amount to cruel or inhuman or degrading treatment and even torture, and confessions which are made quite often as a condition for being granted bail. We also see in many countries judicially ordered treatment, where in several states authorized judicially ordered drug treatment as a result of criminal justice proceedings. And it is very important here to recall that the threat of imprisonment should not be used as a coercive tool to incentivize people into drug treatment. And finally, it is the issue of mandatory minimum sentencing and disproportionately long sentences for drug-related offences that have sometimes resulted in some states in sentences for drug-related crimes which are actually longer than those which are handed out for serious violent crimes, even such as murder and rape, which indeed in turn contributes to the overcrowding and over-incarceration in prisons across the world. What we also see is the provision of and issues arising in relation to provision of specialised healthcare in criminal justice settings, so police and prisons. We know that according to the UNODC data, around 20% of persons who are incarcerated use drugs, compared to only about 5.3% among the general population. But what we know is the rare provision of opioid substitute therapy in prisons, and when these are actually provided in prisons, they may be available only in limited number of prisons or only in male prisons, and in some countries this would only be available if you were actually part of that treatment program prior to your imprisonment. There is an issue with needle and syringe programs, which is even worse than with the opioid substitute therapies in prisons, which are very rarely available and generally already noted, and I'm sure that the audience here will agree with me, that in generally, due to the very short duration that people are meant to spend in police custody, police stations simply are not equipped to deal with these issues, and yet they are expected to deal with it. And finally, very briefly, I also want to touch upon the issue of release, because some states do not allow persons convicted of drug-related offences to be considered for suspended sentence, for parole, even for pardons and amnesties, which are often available to those which are convicted of other crimes. Some states also do not allow reduction of sentences through work or study for drug-related offences. Now, these are a long list of problems that have been identified by various UN human rights mandates in relation to the implementation of drug policy, specifically in the criminal justice context. But what are the solutions? And here I very briefly stop with an example which I'm sure you're very well familiar with, and that is one of Portugal, where we know that the acquisition, use, or possession of drug for personal use has been decriminalized. So when a person is caught with no more than 10 daily doses for personal consumption, and the police have no suspicion or evidence that supply offences are involved, the drugs will be seized and the case will be simply transferred to the Commission for the Dissuasion of Drug Addiction. Options available to this commission include issuing a warning, banning a person from certain places or premises, or meeting with certain people, obligation of periodic visits, etc. If a person fails to engage to meet with this commission, an administrative fine can be imposed or a community service may be imposed. For repeat offenders, sanctions again include fines and obligation to do social work, withholding social benefits, and group therapy. And for drug-dependent persons, the Commission will really go out of its way to try and persuade this person to engage in voluntary drug treatment. What the UN bodies, what all of this, what I've tried to say here today, and in my final slide, and this is mainly meant for your reference if you are interested to go back and look at some of these reports that I have been referring to. The fundamental point that the UN human rights bodies are saying is that the drug issue is a human rights issue, it's a health issue, and that's how it's to be treated primarily. As the Working Group on Arbitrary Detention said in its study, which was conducted and published in 2021, drug consumption or dependency is not a sufficient justification for detention in itself. Drug problem is a health problem. Thank you.
Many thanks, Elina, for bringing so many important issues to our attention, so many, and also for raising the who question. Who is stopped, who is arrested, where and when, because I have a feeling that we often feel in our everyday work limited by the law. But it seems there is some flexibility even within the existing laws and the decisions that can still be made. But I'm very, very happy that we actually have a serving politician with us, thinking about the laws and who actually can influence the legal framework. So I'm really happy that we have Senator Lynn Ruane with us, an independent Irish politician. As I'm saying, the senator and the deputy leader of the Civil Engagement Group in Irish Senate. Lynn is the member of 3 parliamentary committees that focus on issues such as justice, drug use, children equality, disability integration, and youth. And Lynn is also a long-time community and drugs worker, and right now as a legislator, she tables bills which respond to the lived experiences of those on the margins of society. So, Lynn, I would be really grateful, and I believe that the audience is really interested to hear about some of the country-level political efforts to introduce a public health approach to drug policy and to remove minor sanctions for drug possession.
Thank you, Magdalena, and thanks very much for the invitation here this morning. So a little bit about the Irish context. We've just come out of a Citizens' Assembly on drug use in Ireland, which is a really important tool actually in democracy in terms of having a random sample of citizens feed into the process of an issue that people feel there is some contention on. But time and time again, the government in Ireland have been told that there is no contention, that the contention exists within the institutions, not actually amongst the public. Previous to the Citizens' Assembly, there was a health survey consultation that went out to all the people of Ireland, which had 22,000 submissions in and around return, the highest ever rate of contribution to any consultation held by any department in Ireland, which overwhelmingly also spoke to decriminalisation as the way forward. The Citizens' Assembly on Drug Use in Ireland also called for full decriminalisation. And what was very important about that for us was it was all substances, because often people talk about, well, we'll decriminalise cannabis, but not decriminalise other drugs. And for people, I suppose, who work in the sector and activists, we all know that a drug can't be criminalised. A drug is a substance. A drug doesn't feel the shame or the stigma or the health impacts. It's not the drug that goes to prison. So it's not a substance that's being criminalised, it's a person. So when we start to talk about what type of drugs, what we're really speaking to is what type of people. And it goes back to who is policed and who isn't policed. So in Ireland, heroin use and crack cocaine use would be most prevalent in the communities in which I came from. I came from one of the poorest constituencies in Ireland and still live there. So my experience of policing hasn't always been a positive one, because decisions are made at police level as to who is stopped and searched. The biggest and loudest opponents in Ireland to drug decriminalisation has been the police force to date, and that has been their fear around giving up the stop and search powers. And it's using that stop and search powers not because they're overly concerned about small possession, it's using the stop and search powers to detect other crimes. So it's a tool of, I suppose, harassment in some sense and abuse in some sense, and to try and find other crimes or try and find the sources of supply. What was really great about the Committee on Drug Use that followed the Citizens' Assembly on Drug Use, so the Committee on Drug Use was made up of parliamentarians from both houses and just published an interim report. And what was really interesting from that perspective was they clearly called for an end to Section 3 in the Drugs Act, which would remove the stop and search powers for that section, just for possession or suspicion of possession. But what was really great about that committee was we had the commander in Porto, we had some police from Canada, all contribute to that so that Irish parliamentarians could actually hear from their peers, because I don't think the police force necessarily want me to be telling them how to do their jobs, but they're more likely to listen to each other and listen to the experiences abroad and be empowered by other countries' experiences of how policing can look different and can be different. And what really struck me was the commander of the police force in Porto. He said that he has full trust and confidence in his police force that they wouldn't need that type of power to actually do their jobs, because he has full belief in their ability to be able to detect and investigate crimes that are beyond drugs possession. And I thought that was something very important, I suppose, for the Irish context and for Irish police to hear, because I suppose, believe it or not, and I'm sure most people know, is police also use drugs. You know, there's members of the police force that use drugs. There's also members of the prison staff and prison officers who use drugs. So when we talk about who and who isn't targeted when it comes to policing or when it comes to criminalisation, we have to remember that people who make decisions about what happens to those who are poorer than them or from a marginalised community are also engaged in the exact same activity. So your jailer, in a sense, in a prison, can also be going home that evening and having some cannabis or having cocaine, and the problem is that he will never ever have to encounter the legal system, because he is very unlikely, or she is very unlikely, to be stopped and searched, because it is not the professional class that is stopped and searched on the streets. It is people from minority communities and working class communities. So the laws in and of themselves are classist. So when we begin to say we will decriminalise one drug and not the other, that's a further compounding of a class system that says we will police certain people for a behaviour and ignore that exact same behaviour in another person. And I think the Citizens' Assembly understood that, and I think the Committee on Drug Use understood that as well. But unfortunately, we're in an election at the moment, and our Prime Minister just last week said that he doesn't think he can go into a government and decriminalise drugs possession because that's a step further than health-led. And that made absolutely no sense to me, because decriminalisation of the person and the individual is the only health-led response. That is the health-led response. And I think it really shows, I suppose, sometimes a lack of understanding at the top of decision-making, when everybody else around them are very clearly saying, this is the evidence and this is what we need to do if we're going to have a fairer society with sensible drugs policies, and with actually the potential to actually heal relationships between the institution and certain communities, or between police and certain communities. There's actually a potential to re-establish what that relationship can look like in certain communities, and I think that's really important. The Drug Use Committee, made up of parliamentarians, also clearly said that mandating healthcare was not an option for us in a decriminalisation model, that we cannot mandate people into healthcare. We do not mandate people into healthcare for anything else. So why would we mandate people into treatment for something that we are saying is decriminalised? What we have said is very clearly is that all options for healthcare intervention should be available as many times as the person requests or needs them, or how many times they have to return into those places of treatment or detox or community care or education. So what we're saying is, of course, that we value and want to make sure that the systems and services are in place, but we're not going to force somebody into treatment and say that drugs are decriminalised, because it's actually just paternalistic, really. It's really saying that we want you to be different and we're going to decide that we're going to force you into treatment when that's not your personal choice in that moment. Currently in Ireland, what they're trying to say is a decrim model, or a health-led model, is actually an adult caution system. So it's basically saying that on your first occasion that we encounter you, you will not be arrested. On the second occasion that we encounter you in possession, you will not be arrested. On the third occasion, we will arrest you. And that's not actually health-led approach. Because basically the people who are most likely to be caught, the 1, the 2, the 3, the 4, the 5, they're people who are actually struggling in dependency or living on the streets in Dublin City and other urban centres. They are not the recreational user or the professional class or the person who may only encounter a guard once at a festival and never have to experience police again. It's actually the most marginalised who still don't benefit from such a system like an adult caution scheme. So I think the message I would finish on is that I think it's really powerful when people in high places are very open about what doesn't work. And I think that really has to come as well in terms of departments of justice and in terms of police forces. Because when we did have likes of even the Canadian police contribution to the Irish committee, was also really interesting too, because opponents of decriminalisation have tried to use Canada as an example of where decriminalisation has had to be rolled back on. But the police force to the committee were very clear. We as a police force support decriminalisation. We did not want any rolling back of decriminalisation in Canada. What happened was the legislators failed to have provisions in there that could manage public consumption and public use. So that was the issue, not the actual criminalisation of the individual, but actually being able to have any sort of maybe public order offences like we do with alcohol in Ireland. In Ireland, the police can take alcohol off you on the street. You know, they can move you on, they can do whatever they want in terms of alcohol on the street. You have to be on a licensed premises. So there's no reason why we can't also extend the same to public consumption under a decriminalisation model. So there's lots of solutions, and I would encourage, I suppose, police who are that way inclined to continue to reach out to their European peers and counterparts to encourage them, because I do believe in Ireland there's police that think like me, but there has yet to be any real breaking of ranks in terms of really calling for a decriminalised model. And I think it's the police force in other countries that understand this issue that can help and encourage their counterparts in other jurisdictions to lead by example and have a very human rights, public health approach to policing and to drug use. Thank you.
Thank you very much. I believe we will all watch Ireland closely. But thank you also for bringing the voices from other places and including them, the voices from the police, from Porto, from Canada, extremely important and interesting. And with the last presentation, we will move the focus to the region, to the CEECA region, and I'll give the floor to the dear colleague, Ganna Dovbakh, the Executive Director of the Eurasian Harm Reduction Association, the umbrella networking organization that unites over 300 organizations and activists across 28 countries of the region. Helsinki Foundation is a proud member of EHRA, which advocates for progressive human rights-based drug policies, sustainable funding, and high-quality harm reduction services tailored to the needs of people who use drugs. And Ganna will present an overview of the status quo in the region when it comes to drug policy and criminalization, unfortunately, as well as harm reduction.
Thank you, Magda, and thank you all the speakers, and it will be hard for me to speak after the brilliant political messages. I will show a couple of pictures from our work, and you will find more information on our webpage, because that's the conclusion and summary from our reports and everyday analytical work. And I will start with not very familiar, with figures which we are not very familiar. We're always saying about harm reduction in the context of HIV, and people are saying, okay, we have less than 1% of HIV cases connected with the people who use drugs, and then the prevalence is very low in European countries. Why should we do the harm reduction? But I'm showing you the hepatitis C prevalence, and you could see the numbers, and that's hepatitis C prevalence among people who use drugs, and that's the cause of death. And we need to understand, it's just to show that we have public health need in harm reduction and in other approach than the putting people in jails. And then I will show the opioid agonist treatment access and the percent of the people who in need of opioid agonist treatment who receiving this. And that's the pain of us, because we are not reaching out to all people who need this treatment in freedom, and not reaching out in prison. And you could see the yellow marks. It's countries where opioid agonist treatment available in prisons, but sometimes it could be only one person who through the court force the system to provide him opioid agonist treatment. And sometimes this treatment is not available for people for treatment, but only for going out from abstinence syndrome. That's how it works in Georgia, for example, in Sakartvelo. So that's the question of availability of this treatment for those who in need. And that's a number of syringes distributed, but you could see actually the level of the coverage of the harm reduction programs. And that's the our pain, that harm reduction programs exist in majority of our countries, a part of the eastern big neighbor who is bombing Ukraine. I will not even name this object. Sorry. I could be a bit political. But the question was harm reduction services, that they are not available in every municipality. They are not available in every city. Every hour harm reduction in this region struggling with the funding. And I will not name countries, but Poland was struggling with the harm reduction funding just recently in the beginning of this year. Czechia, we are proud of, also struggling with the constant funding. Sometimes municipalities are saying, we don't see the drug problems on the street, that's why harm reduction need to have less funding. But the question is that you don't see these problems on the street because harm reduction works and you need funded. And as for the criminalization, we already saw a lot of evidence, and we saw the evidence from Ukraine, which Lyosha presented, and the Poland. But in general, this region is one of the heaviest criminalizer of the drug use and possession. And even if it's not criminalized per se, but it could be penalized, like that's not criminal offense, but administrative, and then fine is so huge that people will be put in jail just not for the paying this fine, which is 3 times more than their monthly salary or year's salary. So you could imagine 3 years' salary you need to pay for being catched with the drugs. And then you are not paying this, and then you are in jail because you are not paying this. And if there are the fine for not paying, then it will be fine on fine on fine. And if you will get legal job, then you will pay from this legal salary only fines to the states. So it's not the proper decriminalization. And you could see how different, like there are no one data for the country, but you could see the difference in the quantity, which called small. We took the marijuana case, but that's different penalties, and it could be very huge. So, and that's what we compare with. We compare with the imprisonment and cost which municipalities and countries are paying for keeping people in prison. And for some countries, we see that the difference between the cost, which for state, for municipality, the real provision of the care services, harm reduction with even the unemployed benefits to the person will cost 10 times less, 15 times less than keeping person in prison. And in the same time, for me, the ironic is that for prison, for every person who needs to be in prison, state finding the money to keep this person in prison, to feed this person in prison. So it's not a problem about finding money to have the prison running, but for those who are in freedom, we are struggling with the funding for health and social care for people who are using drugs. And so yes, everything about the crime was already there, about the regulation and decriminalization. And we also, as association, we always were about the social care, harm reduction association, but now we understand that we could not advocate for harm reduction without the crime, so decriminalization and regulation, and that's something which we now see as a key objective. But as soon it's not achievable right now in the moment, we are fighting with some leftovers from Soviet system, for example, drug registry, narco-учет. And that's specific stuff, and nobody from Europe and the civilized world could understand what does it mean. Okay, you have patients, you have record of the patients. It's okay. Doctors always have records of the patients, aren't they? Why it's wrong? But I could ask you, as people from the Eastern Europe, what is wrong with narco-учет? Like, it's just the record of patients? It is not. In the post-Soviet countries, it is not just a record of patients, because police have access to this, because every driver needs to check if I am in the registry. If you are in the registry, that's why people want to have anonymous drug treatment in their countries, not to be in the registry, because they will lose jobs, they will lose driving license, they will lose opportunity to develop, because a lot of employers will try to get this data from the drug registry. So it doesn't work. It do work as a Soviet system of controlling and not working as a private, anonymous, confidential treatment registry for the doctors. And that's one of the points. The same with the voluntary treatment, compulsory treatment, and the same with the threshold quantities. And I hope that Ukrainian colleagues will share in the discussion the solutions, what we could do with the thresholds, because even changing the thresholds could help a lot in decriminalization. Meanwhile, we are trying in harm reduction, and that's some developing area for our region. It's paralegal and legal support for people who use drugs. That's like harm reduction from criminalization. So it's reducing risks of criminalization, not the drug use. And legal services, it's always something which people ask the first. And paralegal services, it's advice from social worker or peer worker on the making the documents to protect your rights. And of course, it's starting with something which people who use drugs and women who use drugs never ready to act. All communities, all marginalized communities, sex workers, LGBT, people who use drugs in our countries, first, some of the violation of rights, they don't feel as a violation. Until I'm beaten, I don't feel the violence. Until I'm raped, I don't feel the sexual violence. So nothing happened. And I'm such controlled by the police forces and by corrupted police in my area that if I will go to the court or if I will write напишу заявление, like write the application to the police about the violating of my rights, that will be much worse than I will not. So that's the question of paralegal, to convince people really to document the human rights violations. We don't have them, or have them rarely. And what we are doing with the documenting, just a couple of minutes, we are going to mediation, and sometimes we could solve the problem with access to health and with access to basic social care, health care. And that's mediation and paralegal support to the person, but it's going to UN treaty bodies, and actually that's how we met with Elina, and go with the reports and report what is happening and what could be changed on political level. And I just wanted to say that there is QR code, and there are plenty of country cases, and during the conference, together with Elina, we will have the specific workshop explaining how does it work. That's one very political statement, and I'm very happy that we are going in this with the Association of Police Officers for Public Health and Law Enforcement for Public Health, and that's position which we developed together, and we're trying to set the ambitious goals together, what we could do for public health policing. And that's, okay, it's just a statement for now, but because we are working on this statement, we have this conference and we have this dialogue, and I hope we will build in the trust and develop the workforce readiness, and we will develop on this to change the system. I guess that's it. Thank you.